Oh hey, I didn't see you there. I'm actually just reading over my paramedic directives and I came across my bronchoconstriction directive. Did you know that the most common respiratory diseases are caused from cigarette smoke? What a lot of smokers don't understand, that other than the nicotine they're inhaling, they're also inhaling up to 7,000 other harmful chemicals. Tobacco smoke has over 70 known cancer-causing chemicals. What are these, you ask? Let's go take a look.
Tar is the solid particles in tobacco smoke containing chemicals and carcinogens. This tar is brown-like and sticky, leading to the staining of lung tissue, teeth, and fingernails. Carbon monoxide is an odorless and colorless poisonous gas by its effect of taking the place of oxygen in the blood. When people smoke, this carbon monoxide enters their blood, making it harder for oxygen to be transported to their muscles and their organs. Oxidizing chemicals are highly reactive chemicals that can damage heart muscle and blood vessels. These react with cholesterol in the body and can lead to the buildup of fatty material on arterial walls. In smokers, this can lead to heart disease, stroke, and blood vessel disease. There are also several metals in tobacco smoke that can cause cancer, such as arsenic, beryllium, cadmium, chromium, cobalt, lead, and nickel. There are known radioactive compounds also in tobacco smoke that are also carcinogenic and may be a key factor of getting lung cancer. These are just some of the few chemicals found in tobacco smoke and are also found in a lot of other products like nail polish, hair dye, household cleaners, rat poison, and even rocket fuel. Now that we have an understanding of the many harmful substances, chemicals, and carcinogens in cigarette smoke, let's take a deeper look on what they are actually doing to the respiratory system.
Inhaled tobacco smoke moves from the mouth through the upper airway, eventually reaching the alveoli. As the smoke moves deeper into the respiratory tract, more soluble gases are absorbed and particles are deposited into the airway and alveoli. Tobacco smoke and its properties cause damage throughout the respiratory system, from the main airways, the bronchi, to the peripheral airways, the bronchioles, all the way to the alveoli.
In the upper airways, smoking causes a loss of cilia. Cilia are the tiny hair-like projections that protect the airways by brushing away mucus and dust particles, helping keep the lungs clear. Tobacco smoke damages and destroys these cells, making them less effective, thus leading to smokers developing a cough as they're attempting to clear the mucus from their lungs. In the peripheral part of the airways, smoking causes epithelial changes. Many mechanisms of various lung diseases caused by smoking come from alterations in alveolar epithelial cells, which are essential for maintaining alveolar structure, function, and the lung's first line of defense. Smoking induces and increases epithelial permeability, decreases surfactant production, and produces inflammatory cytokines and growth factors, increasing the risk of lung cancer. Cigarette smoke's most detrimental effect on alveolar epithelial cells is cell death, which may be responsible in the pathology of pulmonary emphysema.
Smoking also affects lung elastin, which is an important protein in the lung tissue that is crucial for maintaining lung elasticity and ventilatory function. Smoking can cause irreversible damage to the elastin and can significantly reduce lungs' ability to exchange air efficiently.
Smoking is also associated with changes in mucus production mechanisms. With chronic exposure to cigarette smoke, this causes alterations in the respiratory mucosa from an increase in the number and size of goblet cells. Therefore, this causes an increase in upper airway secretions.
This goblet cell hyperplasia is a classic pathological finding in people with chronic bronchitis, and this is correlated with multiple adverse outcomes such as increased exacerbation, lung function decline, and mortality. Let's hear from a few words from a paramedic on the road and see what she has to say about smoking.
As a paramedic, we pick up numerous patients suffering from respiratory diseases, many of which stem from the patient's history of smoking. The most common respiratory disease I see are COPD, such as emphysema and chronic bronchitis. In 80 to 90% of COPD cases in Canada, the main underlying cause is cigarette smoking. These patients are often on home oxygen, have numerous respiratory medications including inhalers, bronchodilators, steroids, and many more. In many cases of severe COPD, approximately 40 to 70% of these patients will die within the first 5 years of their diagnosis. So, if you don't want to take your next ride in the back of the ambulance, maybe reconsider that next cigarette.
Thanks, Jasmine. Smoking can also increase the risk of contracting pneumonia and other respiratory infections and exacerbate asthma attacks in people who suffer from asthma. Our lungs can become so overwhelmed after years of exposure to cigarette smoke that we lose all of our defenses. From the cell damage to chronic inflammation, our body loses its ability to repair our damaged lung tissues.
Therefore, the only way we can reduce the risk of tobacco-related lung disease is to stop smoking entirely.